Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Christiansen. He's a board-certified naturopathic endocrinologist who focuses on thyroid care. He was a New York Times bestselling author whose most recent titles include The Thyroid Reset Diet and The Metabolism Reset Diet. Dr. Christiansen has been featured on countless media appearances, including Dr. Oz, The Doctors, and The Today Show. He is the founding president behind the Endocrine Association of Naturopathic Physicians and the American College of Thyroidology. Welcome to the show, Dr. Christiansen.
Hey, Stephanie, thank you for having me.
Well, tell my listeners more about you. I told you before we started recording, I followed you for quite a while, but tell us how you became such an adrenal and a thyroid guru.
Well, I guess, I got into healthcare from just my own personal health struggles. As a kid, I had complications from cerebral palsy. I had seizures. I was pretty clumsy, couldn't do sports, things like that. And by adolescence, I was obese. I was really heavy, and back then, there wasn't really an idea of fat shaming because it was just what you did. It was just normal. And that's around the time in which, one's social position starts to become salient. And mine sucked and I really hated that. And it is a real struggle, And I was always into books, astrophysics, Carl Sagan, stuff like that. And out of desperation, I picked up a bunch of health books, and read them. They made some sense. I did some of it. I stuck with some of it, and it just changed my life. And I realized that, if your health is not where you want it, nothing else is really going to line up for you. You'll never really be happy otherwise. And I also realized that the key to that was information. And so it became a passion to learn more and, help others connect with what could help them.
Awesome. Chapter 6 of my book, Your Longevity Blueprint, is all about hormones. And so today we're going to focus a little bit on hormones, specifically on thyroid. So we're just going to dive in. Topic of your new book, talk about new findings regarding the causes of thyroid disease. So I have to prep the listeners here a little bit. We're going to dive deep because a little bit of what we're going to talk about may be a little controversial and they may not be prepared for what you're going to say. So tell us what you wrote about in your book here. The Thyroid Reset Diet. What are new findings, again, regarding the causes of thyroid disease?
Well, we've known forever that thyroid disease has a largely genetic basis. And this is funny. We always think the genetic means my parents must have had it. It actually doesn't mean that. There's a tendency towards that, but half of our genes are not from our parents. They're randomly reassigned. So it doesn't mean it's shown up in the family, but it means there's genetic tendencies towards it. And
Sure.
What that means is the body can do a better or worse job regulating the chemistry of the thyroid, per our genetics. We think that's about 79% of thyroid disease. The remaining 21% is some mixture of changes in other hormones that influence that, which largely comes down to estrogen and female hormones.
Sure.
And then also how the body regulates iodine. What we've known forever is that the thyroid needs iodine to function. And we've learned that iodine requirements are pretty predictable. They do differ per age category. Infants, children have different requirements from one to another, and they have very different requirements relative to adults. Adults' requirements are pretty predictable based upon body weight. But the new thing we've learned, there's been two new insights. So the floor of iodine intake, the minimal amount we need, pretty much we know that no big differences person to person. But the ceiling, how much we can tolerate, at what point is there too much? That's what does differ from person to person. And for many people, extra amounts are water off a duck's back. They're pretty harmless, but they're not the people who are prone to thyroid disease. Mm-hmm. So for those who are, even tiny extra amounts can be harmful. And so one insight is that this is a driver of the disease. Now, there's a concept called true but useless. A lot of things we know might be true, but they might not be helpful. The exciting thing is that this is not one of those. So even if that is what caused someone to develop thyroid disease, it doesn't mean they're stuck with it. So the second big insight is that for many people, if they deliberately go even lower than a certain level for iodine, they have a chance to reverse their disease.
So I'm gonna try to summarize a little bit of what you just said. You're so smart. So you talked about this concept of iodine kind of tolerance and regulating iodine intake. So let's talk about that kind of narrow safe range. So how much do we need? How much iodine do we need per year? And like for an average patient, with average weight, I guess, what do you recommend from a daily standpoint? What do you recommend their intake not exceed?
Well, I should back up even a step further, and I'm happy to talk about this in terms of micrograms. The difficulty is that that's not transparent. We don't really have a good handle on what our daily intake is in micrograms, nor are there easy ways we can test our iodine status. Happy to talk about that in more detail later.
Yes.
But in terms of numbers, we've tracked many, many countries pre and post iodine fortification. And that's given us really good insights on which ranges show the lowest rates of thyroid disease. And it turns out for adults, it's about 50 to 200 micrograms as far as total daily intake. That's where we see the least thyroid disease. And again, for some people, they can go above that, and it might not be a big deal. The World Health Organization has seen that somewhere around that 200 to maybe 1,100 microgram range, if someone's not prone to thyroid disease, they can bump up there on occasion, probably without much harm. But the tough thing is, you don't know if you're prone to disease until you get it.
Sure. You had a unique analogy in your book. I think you said the amount of iodine we need per year is like the size of a lentil, like teeny, teeny, teeny. And I never really thought of it in that way. And so let's talk about some ways, especially for those individuals who already have thyroid disease, who are more prone to needing less iodine. How are they exposed to iodine? So where are some ways they could be consuming excess iodine?
Well, so we get it when it's fortified in salt. That's one big source. And that's directly with just salt usage, but also indirectly in other things that have salt. That started actually first was Switzerland was the first country to do that. And the United States was second. We did that in 1924. First area was Michigan, near the Great Lakes. There's an area that was called the Goiter Belt. And coming into World War I, a lot of young men were not eligible to go serve because they had goiters. And so that made the public health doctors think about this and say, hey, what can we do? And some thought this would be the best solution. Some did not. It was an acrimonious thing. There's a lot of controversy about that. And interestingly, this area was proximal to the Mayo Clinic, which was around back then as a real bastion of medical thought. And what they saw in the Mayo Clinic was that thyroid disease used to be the kind of thing that you learn about stuff in med school, and a lot of things that you and I learned about, we've never seen or barely seen. There's pretty obscure stuff out there. And that's what thyroid disease used to be. In the years after salt fortification, the rate of autoimmune thyroid disease amongst women in their 30s and 40s went up 26-fold, not percent, fold. So it went from obscurity to commonality. So so one big source is salt. So some salt has it fortified, some salt has it naturally occurring.
Let's pause for a moment there on salt, because I'm someone who loves salt. I've always had low blood pressure. I feel like I need it for my adrenals and my stress, whatnot. So, and some of our listeners may also feel the same way. So which salt options do you approve of? So how can we make better choices with our salt selection?
Well, and this is a cool thing. We'll talk more about other sources of hidden iodine. And by and large, there's easy substitutes. There's really painless substitutes for these things. So for salt, you don't have to give up salt. And not only do you not have to give it up, but the choices that I propose are in alignment with what all top chefs recommend. So most chefs argue that it's 1 part per 10,000 potassium iodide. That's how salt is fortified with iodine. And most chefs argue you can taste that it tastes bitter, that it disrupts the taste of the food. So so salt that's naturally free of iodine is readily available. My very favorite, I'm not tied to any of these companies, my very favorite is Diamond brand kosher salt.
Okay,
and
I've seen that.
I love it because the ingredient list is salt. There's nothing else in it. It's just salt. And then the shape of the crystals, also just piggybacking on a lot of top chefs, so the shape is such to where they argue that it does a better job penetrating foods, coating properly, that its structural physical shape is useful. My views on salt have evolved, back in my early days in natural health, I was a fan of sea salt. And my thought was, it's argued to have various nutrients. You're getting some more minerals out of the deal. I thought that sounded like a cool thing. But the more I thought about it, I looked at the amount of minerals we get from sea salt. So, case in point is potassium. Sea salt has potassium. Regular salt does not. So I'd think, oh, if I use sea salt, I'll get more potassium. Well, you do, but the numbers. So we need 2, 3, 4, 5,000 milligrams of potassium on a given day. If your daily salt intake of about a teaspoon of salt, if you swap that out for sea salt, you will boost your potassium intake by about 0.3 of a milligram. So yeah, so if you do 10,000 days worth of salt, you can get about 1 day's worth of potassium.
Wow.
It's
Not a good
about the same
trade-off there.
story. Yeah, about the same story for other minerals in salt. So when sea salt. So once I went through that, I'm like, okay, so salt is not a vitamin. Cool. So it's flavor, it's cooking, it's good stuff for those that need it for their blood pressure, like you said. And towards those goals, yeah, I love kosher salts.
Sure, sure. Okay, let's go back to other areas of exposure. So where else can we get excess iodine from?
Well, so salt's one that does come to mind readily for people.
Yeah.
One that often does not is personal care products. And this one really surprised me. So we used to use iodine in hand sanitizers. And by used to, I mean up to 2018. It turns out that somewhere around 4.5% of iodine will penetrate healthy, intact skin. So it does go into our bloodstreams. And what happens is iodine's a really useful thing. It's a great disinfectant. It really makes creams stay smooth. It's an antioxidant, so it's very useful in a lot of ways.
Sure.
And if you're making up creams at an industrial scale, it's helpful. And so many things that are cream-based have included that. And what's been shown now is that the amount that absorbs is actually relevant. So it was pulled out of hand sanitizers because it was shown that hospital workers were being harmed by it. They were getting enough in their systems to be unsafe, and many were developing thyroid disease disproportionately. Wow. Yeah. And the steps have not yet been taken in terms of personal care products past that point. But if you look at the volume of things used, like conditioner or body lotion or face cream, you look at the volume used, you look at the amount of ingredients that contain iodine, you look at what percent iodine those ingredients have, how much would absorb, how much you would walk away with. And what happens is that if a safe upper limit for many people is 200 micrograms, you might get 10 times that by using a hair conditioner, so sometimes they can really add up.
Never would have thought. Can you speak to, I can't pronounce it. What does PVP stand for that you mentioned in your book?
Well, you pronounced PVP just fine.
What is it? Poly something.
Polyvinyl pyridone. Yeah.
There you go. Yeah. So interestingly, my husband, which probably shouldn't even say this on the podcast, but he bought Crest white strips, and I unpackaged them from the Target bag, right? And I just thought, oh, I'm just going to look at ingredients because something told me Crest white strips are probably not healthy. Guess what the first ingredient on Crest white strips was? PVP.
Wow. Okay.
I never would have thought. I had just read your book. I thought, oh my goodness, this is exactly what Dr. Christiansen is talking about, right? Kind of hidden sources. Never would have known that there was iodine.
I want to be cautious, but I always want to think through like amounts and dosages, kind of like with the sea salt. And I think about that both for good things and for bad things. So there's some things that a lot of our peers worry about that I don't, because I've run the numbers on. And so PVP, there's a lot of it in some personal care products that I don't think are relevant. So mascara has high amounts of PVP. But if we crunch the numbers on how many actual milligrams or micrograms of mascara is applied, how much volume is there, and how much of that really comes into the bloodstream, I don't think it's relevant. So I don't think that anything that has that label is like horribly dangerous, but I do think that things that we use a fair volume of and that actually penetrate our skin are worth taking into account.
Sure. What about carrageenan? However we pronounce that also.
Yeah.
Is that also a source?
Yeah, it can be. And when I first started writing the book, I was concerned about that being present in a lot of consumer products. And the more I looked at things, the more I found that most companies have moved away from it. So especially, I talk about dairy being another big source, and then, non-dairy options being substitutes. It used to be that many of those did use carrageenan as a texturizer, but by and large, that's disappeared. And I think a lot of the work that's been made against it has been useful in this context.
What about fish oil products?
Yeah, so certainly a concern. I do assay my fish oil to confirm that it's not containing too much. As a generalization, though, this comes back to the dosage consideration.
Sure.
So most fish oil comes in at around 1 to 3 parts per million per iodine, and for a dose of 1,000 milligrams or 2,000 milligrams, it tends not to be substantial. So it's something people want to be wary of, but there are a lot of easy workarounds for it.
So are we mostly getting iodine from food like dairy? Is that our main
Well,
source?
so food is a big source. Supplements are a huge source too, and not for everyone, but for those that do consume supplements that have
Yeah.
iodine, it can be the biggest single factor.
Yeah.
Some are just iodine, but then many others have it. One recent study looked at prenatal vitamins, and they took 120 of the most popular ones. Some were prescription, some were not. And they randomly sampled a set of 70 out of this 120, and they assayed the iodine content. And they compared that against the labeled iodine content, what the product said it had versus how much it actually had when they measured it. And it turned out that not a single product was in the ballpark. Like not one product was within 5% of its labeled iodine content. And a lot of them were 2 or 3 or 4-fold above their labeled content.
Wow.
So for many people, any amount added in can be too much if they're trying to manage their thyroid function. But people should know that what they're taking may not be what they think they're taking.
Sure. Good point. I want to go down both the supplement and the food route. So let's bring it back to food for a moment here. So
Yeah.
You can correct me if I'm wrong here, but I think another point that I took from your book is that a lot of individuals who have the autoimmune Hashimoto's, right, thyroiditis, who go gluten, dairy, egg free may see reduction in their thyroid antibodies and improvement in thyroid function, which from a functional medicine standpoint, we think, okay, well, they're reducing inflammation and, that's likely very helpful for them. But I think in your book, the other parallel you're drawing is that, well, their thyroid may be improving because they're reducing their iodine by taking those foods out. Is that correct?
That's exactly correct. And, I've struggled with that because I've heard many people and many practitioners say that they've seen some do better by making those changes.
Mm-hmm.
And then I'll look at the medical literature, and oftentimes those changes have been looked at in controlled settings, especially the gluten element. There've been a lot of good studies looking at how gluten affects people with celiac disease and thyroid disease, and it doesn't seem to pan out. It doesn't seem to be a relevant variable, but yet many say that in their experience, it seems to. And so I think this may be the solution. If we look at our total source of all the various contributors in the diet to iodine, they've been rather steady with the exception of 2 categories. And a change in iodine in 2 food categories has roughly tripled the iodine intake in the last several decades. And that's processed grains and dairy food. So the amount in those 2 categories has gone up. We've gotten it from other sources, but those sources really haven't changed much, but those 2 have.
Sure. So what happens when we exceed, well, I guess maybe I should back up. Like, how do we know at what rate we excrete iodine? Or is that the problem, that we're not excreting it and we're getting this huge burden of iodine and that's making the thyroid quit working? Can you explain the dilemma or the problem with too much iodine and how that impacts the thyroid?
Yeah, well, for starters, we've got to take all of our valid intuitions about how nutrients work and just throw them out the window because none of them apply to iodine,
That's
so we got to start
hard.
there. We take vitamin C, and there's arguments about, a speck will prevent scurvy, but of course, more than that is better for optimal health. And if you take too much, you're not going to die from that, So we've got these intuitions that are largely valid for most nutrients, but they just don't apply. So here's some of the reasons why it's different. We only know of one crucial role that it has, and in only one part of the body. And the other big thing is that the quantities of it in play, so the amount of it in our bloodstream, is not sufficient for its chemical purposes. And that's not true for other nutrients. So it's got a pump. It's got a designated concentrator. It's called the sodium iodide symporter. Mm-hmm. And the basal circulating amount of iodine could not allow our thyroid to work. So we pull it in and we concentrate it against a gradient. So the amount of iodine in the thyroid is 50 to 200-fold above what it is elsewhere in the body. So it's a separate compartment. And iodine is oxidized within the thyroid. So now, to be more precise, we really want to say iodide, because by and large, when it's in the diet, in the gut, in circulation, it's in a reduced form called iodide. But there's an enzyme called thyroid peroxidase that oxidizes that into iodine. So now it's become a hot potato. And I get this image of like the scientist with the big gloves and the long tongs holding this smoldering beaker at arm's length. It's kind of like that. It's something that's useful, but it's dangerous. And so we make a little bit just where we want it. And everywhere else in the body, we do not have iodine because we don't have the tools to make it or to tolerate it. Now, the one difference is that if we ingest so much that it spontaneously makes iodine, then it becomes fatal. And it was actually a popular means of suicide 100 years ago. So yeah, it's dangerous in excess. Now, because the thyroid concentrates it, there's a lot of checks and balances. And one of those just shuts off all the thyroid machinery when there's too much iodine. And if that wasn't there, if it kept on concentrating it and running the assembly line, when we had more iodine, we would make radically unsafe amounts of thyroid hormone. So to prevent that, we just hit a switch, we shut down the whole assembly line, and we stop making thyroid hormone when there's too much iodine. That's not intuitive. The other thing is that since iodine is a source of free radicals, that's why it's a disinfectant. When there's a little bit extra inside the thyroid, it makes the thyroid damaged, and it creates an environment that recruits immune cells, and they start perceiving thyroid structures as being foreign. And that's basically the onset of thyroid autoimmunity.
Interesting. Gosh, I want to ask you 5 more questions based on that.
Go for it.
I want to go
I'll do my
back
best.
back to where you're saying we know the one organ that iodine has a role in, right?
Yeah.
What about patients who believe iodine is helpful for breast, like for fibrocystic breast health, whatnot? Even in my fellowship program, I remember Jonathan Wright saying, there was a case where they actually painted the cervix with iodine, and right there on, this was a demonstration, the patient's fibrocystic breast tissue basically just melted away, dissolved. Like, there are some compelling case testimony. It's not that I have done that with my patients, to the benefits of high dose iodine, for other organ systems in the body. So what's the rebuttal, or what do you say about the evidence there?
For sure. So what I was saying was iodine requirements, not the same as iodine metabolism. So now that device that pulls iodine inside the thyroid is called NIS, the sodium iodide symporter. That is present in other tissues. And some of those reasons are just embryologic overlap. Some of the tissues that evolve and form into thyroid tissue are also multi-purposed and made into other parts of the body. So in some cases, NIS shows up elsewhere, not for reasons that it's used there, but just because there's common embryologic origins. Now, the one exception is breast tissue. And I was saying before how the basal amounts of iodine in the serum are not adequate for the thyroid. They're not also adequate nutritionally for a nursing fetus. So the breast tissue has the expression of this same concentrator, and that allows breast milk to have an adequate concentration of iodine. Now, not true for other nutrients. The nutrients in breast milk pretty much parallel the nutrients in the bloodstream, with the exception of iodine, because we concentrate that. So then we think about the role that NIS has outside of lactation. And it turns out that as a sodium iodide symporter, as a sodium pump, it does also pull fluid inside of breast cells. So it causes a hypertrophy of existing cells, that they swell. And we now know there's a spectrum of NIS activity. So non-lactating women with healthy breast tissue, there's no real active NIS activity. The lactating women, there's more expression. The next step up is now called fibroadenomatous breast disease. It used to be fibrocystic breast disease. And in that case, there's an exaggerated activity of NIS expression. And so what happens is part of the mechanism of this disease process is that device, that pump, is causing fluid retention. And there's cellular hypertrophy, and there's pressure from that, and there's pain from that. Now, if we go back to what I was saying about iodine and the thyroid, a lot of iodine stops the thyroid, and that's because it stops NIS. So we know about this, like in the case of Graves' disease. If someone's thyroid is putting out fatal amounts of hormone, the only way you can stop it in that moment is to give a massive amount of iodine. That's like the most aggressive way to stop it in those worst case scenarios. So with fibrocystic breast disease, if you give a high dose of iodine, you can stop the expression of NIS. You can stop the activity of that pump, and you can lower the overall hydration status in the breast tissue. Many took that factoid and misinterpreted that to mean that these women had a higher nutritional need for iodine. And it's important to know that nutrients can work as nutrients, but they can also have pharmacologic effects that are independent. Niacin is a great example of that. We need it for its roles as a B vitamin, and in massive amounts, it lowers an enzyme that makes cholesterol. So it would be a misunderstanding to say that cholesterol elevation is a niacin deficiency and that people only reverse that with a massive dose. No, it's a pharmacologic role of niacin. And so too with iodine, it has pharmacologic effects. And so a pharmacologic effect of iodine is that it lowers the activity of NIS in breast tissue. So then the other speculation that's been made is, okay, if there's this thing going on in fibrocystic breast disease, and with the mistaken thought that it was because of nutritional requirements for iodine, then some speculated that there may be a similar effect occurring with breast cancer. And the plausible piece of data that seems to fit that is, Japanese women, they consume more iodine, they have less breast cancer. So it seems a sure fit that iodine would be preventive for breast cancer. And what we now know is that continuum of NIS activity, again, the basal no amount is non-lactating healthy breast tissue. The peak of that is breast cancer. So breast cancer has the most exaggerated NIS activity. And Japanese women have less breast cancer, but of course their iodine intake is not the sole difference. There's many other differences between them and other groups of women. Yep. And they've shown that within Japanese women, you can take groups of them and you can look at those who do develop breast cancer, some still do, and you can look at those that don't. And their iodine excretion predicts their breast cancer risk. So the higher they are in terms of their iodine intake, the more likely they are to develop breast cancer. And
which is the opposite of what I would have thought.
Right. And this has been shown in other cultures as well. And we also now know that because of this NIS activity, there's research taking place as to perhaps radioiodine may be a useful treatment for breast cancer because it preferentially takes up iodine like thyroid cells do. So yeah, there's been talk about iodine being a screening tool for breast cancer risk, but also as a treatment for breast cancer. So this is one of many cases to where ideas that have gotten popularized in one group are pretty much the exact opposite of what biomedical research tells us.
Fascinating. Okay, so for the listeners, again, I got to dumb this down a little bit.
Basically, if you were fearful about lowering your iodine intake because you were worried that it might hurt your breasts, no, probably the exact opposite.
Opposite, literally the opposite. Yes, you summed it up well. So I want to talk about supplements, and I think I may bring in another piece here that I wanted to talk to you about together on this topic. So from a supplement standpoint, historically, like through my functional medicine training, I've been taught iodine is beneficial for thyroid health, and therefore most thyroid support products are going to contain some iodine, right? I think T4 and T3 are literally made out of iodine, like we need iodine. So, but essentially you're saying we're getting too much iodine between the combination of food and supplements and personal care products and whatnot, right? And so you recommend, which I want to get to at the end here, the diet that you propose, but you're also recommending that we screen our supplements. So literally you're saying prenatal vitamins have iodine, a lot of thyroid support products have iodine.
Multivitamins
are going to have iodine that we need to be screening. I want to bring in kind of the Brownstein camp here. I did mention Dr. Brownstein in my book in chapter 6, because at that point, I was in agreement that I thought, okay, well, we need iodine. And he is in the camp that we need lots and lots of iodine. So how do you kind of rebuttal that? And that, do you feel like that the literature that he kind of proposes that we need high dose iodine, do you just feel like do you feel like there's not evidence to support that?
Yes, very strongly. And we should be more accurate. It's not fair to call it the Brownstein camp. This is really the Abrams camp. So this was not unique to David Brownstein. This is data that he just took directly from Guy Abrams. Guy Abrams was a gynecologist from LA. He's deceased. He was a kind man. He was a dear man. I spoke to him many times in great length. I read all of his work, followed all of his references. Sure. So I was in a window of opportunity that David Brownstein was in as well. We were really paralleling our interests in Abrams' work. The difference is that I also read outside of his work.
Sure.
So it was highly theoretical. It was highly based upon these plausible mechanisms, and much of the ideas were plausible. And if you think about iodine the way we think about other nutrients, a lot of it seems intuitive. We think that if the thyroid needs iodine and it needs some for it to work, for no debate about that. And not everyone's getting too much. I don't want to make that sound to be the case.
Sure.
Not the bill in all cases, all people. But the idea that the amounts we need are far in excess of what everyone else has said is simply not true. We've got a massive data set from the last century of how iodine influences thyroid disease. And it's intuitive to think that if a nutrient does something, more of a nutrient would do more of that same thing. But that's just not how nutrients work in the body. We think about a nutrient almost like a gas pedal. The harder you push it, the faster the car goes, And I think about them more like keys. If the key's not there, your car will not budge. I've driven Jeeps for like 30 years because I do a lot of time in the backcountry. My Jeeps aren't fast, right? That's just not how they are. And if I got 20 sets of keys, my Jeep would not be a Ferrari. It's just not how it works. If the key's missing, the Jeep won't move. On the other hand, if I'm driving along and there's some mechanical problem taking place and the key's already in the ignition, more keys also won't help with that. And there are times like in this situation where more keys are counterproductive. So these are ideas that seem internally like they might make sense, but once you hold them up against the massive data sets we have from the last century of looking at iodine for literally thousands of different populations, mechanistic models, interventional trials, we've seen all this. And it makes me sad because if you also go in the medical databases, you'll find many case reports. And there's many of these written up very detailed about how people have followed those types of guidelines to catastrophic results. There's now 5 published cases of babies born with congenital hypothyroidism. And that may permanently ruin someone's whole life arc. And these papers specifically state Brownstein's work, and they specifically state his protocols and that the women were following them as they were told to do in his books. So these things are talked about. They're not safe. I don't doubt that they were made with good intent and with genuine belief, but it just doesn't align with the facts that we have.
Yeah. Good answer.
I'll share a link with you. I've given a better answer to this. I've just gone through like tons of references that they've shared, and I've talked through this in about a 20,000 word blog post that I wrote about the whole controversy. And I'll share that for yourself and your listeners, and anyone that wants to go through that in full detail, it's available.
Thank you. Let's go back to supplements for a moment. So if we're not going to give iodine to support thyroid function for patients who are lower end, can you briefly mention, I know you have thyroid supplements as well. What are your top agents, like the top nutrients that support thyroid function that you're full?
Well, your thyroid is really a homologue of your body, so all nutrients have some relevance. Selenium may be of the most important. The biggest question I get that I think about is, what can help someone with thyroid disease? If they're already on treatment, they're not yet on treatment, what can turn that around for them? And I don't see a lot of examples to where a lack of nutrients is the cause and to where that really reverses it. I've not really found evidence published about that being a factor. So I do think their health is served, and that any outcomes they embark upon will be more effectively met if they're not missing some key nutrients. But I don't see that as a standalone solution for thyroid disease.
Well, let's talk about your solution then, which is your kind of thyroid reset diet. Can you briefly, you map it out very well in your book, different phases. Can you briefly summarize for the listeners what you propose then? So for patients who have thyroid disease, whose iodine intake is too high, what is the reset diet in your book you propose to help them get rid of iodine and improve thyroid function?
Well, one thing I'd love to, if no one takes anything else away from the talk than this is one thing I'd love people to hold on to. If you hear things and you're not sure if they're true or not in the medical world, just ask yourself, is someone talking about how something might work or what's actually been shown to happen? It's very easy to get deep into mechanisms. This does this to the mitochondria, therefore it's good for us. But it's actually been shown to do something in a living human, that's in a meaningful way. This is the part that matters the most to me. We can make mechanisms for anything we want all day long, both directions of the argument, no problem. So what really compelled me was one first clinical trial. And in this clinical trial, a group of people were taken who had advanced thyroid disease. They were not on medication. They had been hypothyroid for between 4 to 5 years. And for some of your listeners, this might make sense, but their average TSH scores were 14.1. So they were quite a ways away from normal thyroid function. They were far out of range. There's nothing subtle about it. And they had also been tracked for about the past 2 years to show that they were steady at this state. They weren't in the process of random fluctuations. They were pretty much stabilized and plateaued where they were. Many in the group had worse scores. Some had TSH scores in the 50 to 200 range, and we'll come back to them. So for a 3-month period, what they had them do was lower their iodine intake, nothing else. Now, this was inspired because people have been asked to deliberately lower their iodine intake before they do medical procedures. There's 2 that are done in which your thyroid has to be hungry for iodine for the procedure to be effective.
Sure.
And many had observed that those preparing for the procedures had spontaneous improvements to their thyroid health. And the more that became known about the mechanisms of excess iodine being harmful, the more some wondered, hey, maybe this was actually helping. This is why they got better. So they did a formal trial to test that. And in the 3 months after they got their iodine, they targeted their iodine below 100 micrograms. They tracked these people. And so they were tracked beforehand for their iodine status. And we can talk more about that. They were tracked afterward. And it turned out that, we were humans, not everyone was compliant. So some people just did not get to a therapeutic lower level of iodine. So their outcomes we have to take with a, grain of salt. Sorry about that, but talk about salt. So before we even talk about who did the diet and who really didn't, 78.3% of them had normal thyroid function in 3 months. They didn't go on medication. They didn't take supplements. They didn't meditate. They didn't clean up their diets. Tons of things that might have been good in various ways. They didn't do. All they did was target a reduced iodine intake. And 78.3% were perfectly normal. So if that's all we had, that would be awesome.
Wow.
I've watched for years and tried to find things that help thyroid function. And everything else I've seen in terms of diet and lifestyle has been subtle at best. It's been maybe small changes in scores of a few percent or subtle changes in indirect markers of the disease like antibodies, but nothing like that, nothing to where the disease reversed for like most of the people in it. I've never seen anything like that before.
Right.
So 70.3% were totally better. So that's not all. If that were all, that'd be great. But now let's think about the fact that some people didn't do the diet, okay? So they were part of those that didn't get better. The other consideration is that some of the people that didn't get better did get better, but they didn't come back to normal ranges. They were the ones who had the massively high TSH scores. So they came down by on average 50%, but they didn't yet come back into the normal range. So if we look at it and say, okay, of those who really did do it, how many actually got better in a meaningful degree? That number is 97%. So 3% of people who did it saw no useful change to their thyroid health. So
but
the rest of them did.
Yeah. Wow. So is this something, I don't know, was your book published this year? Is this a 2021?
Yep.
Yeah. So obviously you've had this knowledge prior to writing the book. You used to write the book. How long in your clinics have you been implementing this? And are you seeing this over and over again with your patients then, to speak from experience?
I am. I do have to say that I've had a thyroid focused practice. I have not practiced for about 7 years now, but I oversee my doctors. And that's been like 97% of what we treat as thyroid disease.
Yeah.
As such, we really don't see people that are not on thyroid treatment. They already are before they come in to see us. So we're seeing a different group. There have, since that book was published, there was a large study done like that, except for those on thyroid treatment. And in this study, they gave very, very basic recommendations about avoiding iodine supplements, avoiding iodized salt, avoiding seafood. They didn't go in much depth past that. But what this study saw was that of those on treatment, 84% could successfully reduce their treatment with no ill effects. And 50% could basically discontinue treatment with no ill effects, with no symptoms and stable thyroid levels. And yes, we've seen similar trends.
Wow, that's amazing. So if you're listening and you want to try reducing iodine in your diet, Dr. Christiansen maps out how for you to do that in his book. Absolutely. I want to ask your opinion on another, I guess, back to diet trend, which is intermittent fasting. Are you for or against that with thyroid disease? Like, what is your theory, good or bad?
Well, good or bad. If it's after this, so there's 2 scenarios here. So it's after the fact, someone says, hey, my weight's never budged. I did this. Now I lost weight. I'm for it.
Sure. Proof's in the pudding.
Totally
it worked, right?
So now the other way the question gets asked is, I've tried everything. I don't know what to do next. Does the data suggest this will work for me? I'm like, well, the biggest data sets we have on intermittent fasting and thyroid disease come from Ramadan, actually. There's the largest number of people we've had that have been tracked.
Yeah.
And they're doing something a lot like intermittent fasting. They don't eat throughout the daylight hours and then eat at night. And there's been 3 large studies in which their thyroid function has been tracked. Mechanistically, we know that when someone's food intake goes down a lot or their food timing changes radically, or their carbohydrate intake changes a lot, goes down greatly, the body can perceive that they're in a starvation state. And the thyroid is one of the biggest levers that controls our basal metabolic rate. So when the body perceives a starvation state, it often lowers thyroid output and it lowers the activation of thyroid hormones in circulation. So we know that from mechanistic models, and we've seen that from ketogenic diets with children, things along those lines.
Sure.
So in adults on Ramadan, the average TSH scores of those on thyroid treatment go up by about 50 to 75% after the course of that. There hasn't been long-term follow-up to see if this has longer lasting effects after that's over, but we do know that in the weeks and first month afterward, that the thyroid has to work harder by about 50 to 75%.
I have not heard that. I'm happy to hear that. Okay. Wonderful. You're a wealth of knowledge. You're so smart. Thank you so much for coming on the show today. I have just a few more points here. I definitely want to make sure listeners can connect with you. So where can they find you, and what is this amazing free gift that you have?
So easiest source is drchristianson.com, drchristianson.com. And one more thing, if you go there, you'll see my social media links. I do something called Office Hours Live. I've been doing this lately, most Mondays, 3 o'clock Pacific. I jump on all the channels. I'm on Instagram, Facebook, and YouTube Live. And I just talk for about an hour and field some questions. There's usually a few things I've got top of mind that I think are worth sharing that I'll start with, but then I watch for really good detailed questions and I have some conversations with people. So that's a really easy way to just connect actually in person. So yeah, Office Hours Live. And I'm sorry, the second part of the question was
free gift. Free gift.
Oh, free gift. Yeah. Okay. So the story we talked about, the whole iodine thing, yeah, it's counterintuitive, it's surprising, and it's often just shocking, these hidden sources. So I filmed a well-made docu-series all about that. This is called The Invisible Iodine, and it's a 7-part series, and your listeners can check that out for free. We've given you a special link by which they can get to that, and they can learn a ton more and figure out how they might wish to pursue this, if it's relevant for them or not.
I absolutely want to watch that myself. Wonderful. I conclude every episode with your top longevity tip. I'm sure you have several, but if you had to pick one, what would your top longevity tip be?
Yeah, that's a good one. I've thought a lot about that. I've given different answers to it when I've thought about this in different times. At this point in my life, I think it's going to be speaking your truth, and living your truth. When I wrote the Adrenal Reset Diet, there was the Whitehall 2 study that had come out rather recently. This was done on British civil servants, pretty big age range, like 20 to 70. And it just watched them for a 4-year period and saw, who died and who didn't. And there was a lot of health metrics that were tracked on these people. Some were common ones like blood pressure, cholesterol. They also tracked markers of social stress, including cortisol slope. And what they saw was that social stress was a stronger predictor of early death than any other factor was. So yeah, I think that we're in a time in which there's so much divisiveness, and I think we really walk around on eggshells quite a bit. People have different views than we do. And I think we hold in a lot. And I think that we don't engage in a lot of conversations that could be healthy and could be productive. So I think right now, my biggest thing is trying to speak one's truth.
It's beautiful. Yeah, good timing for that. Well, thank you so much, Dr. Christiansen, for coming on the show today and shedding light on this, I'll still say, controversial topic. But thank you for sharing just this idea of iodine intolerance and tolerance. And hopefully these tips that you offered today will help all of my listeners with their thyroid health. And I encourage they all connect with you. So thanks again for coming on the show.
My pleasure. Really good questions. I appreciate the interview.